Our OBL business has really benefited from the radial-to-peripheral practice. Specifically, when you are working in an OBL, the number one consideration is safety. We always want our patients, we want the procedure to go well without any complications, and nothing can be worse than a femoral artery complication requiring the patient to have to go to the emergency room. With the radial to peripheral approaches that we are now employing in our OBL setting, our complication rates are very low. Patients are able to sit up, they're able to leave our OBL walking without any issues of groin access site bleeding when they leave.